did my speech on dissociative identity disorder. It was previously known as multiple personality disorder, but it got renamed because this name is more accurate. So what exactly is dissociative identity disorder? It is a mental disorder characterized by the maintenance of at least two distinct and relatively enduring personality states. It's accompanied by memory gaps beyond what would be explained by just ordinary forgetfulness. Basically, it's switching to alternate identities, and each identity has a different name, a different personality, and a different personal history. So why do you get dissociative identity disorder? You develop DID in your childhood because you experience trauma. Most often it forms in people who were subject to long-term physical or emotional abuse in their homes or their schools or just wherever it was, wherever it happened. So why does this happen? Your personal identity is still forming during your childhood, so you're more able to step out of yourself and observe what's happening around you like it's happening to someone else. That's called dissociating. So it always occurs in response to a perceived threat. It always occurs when you're going to go through trauma. It's when you step out of yourself to observe what's happening like it's happening to someone else. So when you dissociate as a child, it turns into something that the person does to cope with the different situations that they're going on, the different things that are happening. And if you keep doing it enough, you'll eventually develop multiple personalities to cope with the different situations that happen to you in your life. And each personality is called an alter. So there are many different types of alters. The first type is the host, and that is the original personality. This is who they started off with. If they hadn't experienced this trauma, this is how a normal person would have been if they hadn't gone through any of the trauma. That's who they would have been. Then there are the child alters, or the littles, and they speak and act like children, and they are basically a version of the person without any of the trauma that they experienced. They're like the embodiment of the innocence of the person, basically. And then there are fragments, and the fragments aren't an entire alter. Their job is to hold a specific memory or emotion to protect the rest of the system from it. So if the host went through a particularly traumatic time or something like they had a really strong emotion, then they would have a fragment, and the fragment's job would be to protect the rest of the system from experiencing that. So they basically forget it, so the fragment remembers it, but the rest of the system doesn't. And then there are protectors, and the protector's job is to keep the system safe from trauma by taking the place of the other alters when there's trauma that might happen. So they experience it instead of the others. Basically, if there's a traumatic situation that's about to happen, the protectors will surface and experience that trauma so the rest of the alters, like the littles or the fragments, don't have to experience it. So they focus on defending the system and keeping the system safe. And then there's the gatekeepers, and their job is to keep the traumatized alters from surfacing, because traumatized alters may wish to harm the body, obviously, which wouldn't be good. And so their job is to just, if they see like a traumatized alter is trying to surface and mess something up in the host's life, and they'll push it back and be like, no, it's not, you're trying to surface. So those are the different types of alters. So what are some symptoms? Some symptoms of DID are memory loss of certain events or people, because if an alter surfaces, then the other alters sometimes won't remember what happened. You also will feel detached from your emotions and situation. You won't understand what's going on sometimes. A perception of the people and things around you will be distorted. It'll feel unreal. You'll have a blurred sense of identity, because if you're a bunch of people, then who are you really? Like, if you have so many other people living in your body, then you really aren't anybody. There's significant stress in your relationships, in your work, and other important areas of your life, because you're living with this crazy disorder. There's an inability to cope with emotions and stress and mental health problems like anxiety and depression and things like that. So what can happen if you fail to treat DID? The main result of not treating this disorder is losing a sense of who you are as a person. So this will result in depression and a lot of psychological effects too. So that'll be things like suicidal thoughts, alcoholism and drug abuse, PTSD, post-traumatic stress disorder, and a lot of different personality disorders too. You can be paranoid, narcissistic, OCD. There will also be a lot of sleep disorders like nightmares, insomnia, night terrors, sleepwalking, a bunch of crazy stuff that can happen. You'll also get eating disorders and like a bunch of different eating disorders. You also have physical symptoms like seizures. As you can see, it is very serious. If left untreated, DID is super duper harmful to your body. You definitely need to get it treated. So, how can you get help if you have DID? Basically, if you have experienced trauma, obviously the first thing you need to do is talk to someone. This can be a trusted friend, a doctor, or someone within your faith community, like a pastor or someone like that. It also helps to talk to a professional. They can help make sure that you do have dissociative identity disorder, and they can help you cope with it, and it helps to talk. The main treatment for DID is speaking therapy, which is things like talking to a therapist, psychotherapy, and family therapy. Because if you have a disorder like that, medication and drugs and things like that, they won't help. They'll just make it worse. So the best thing you can do is talk about it and help figure out what's going on and treat it like that. So how can you help someone else? The best thing that you can do if someone has DID is be a sympathetic listener. Don't try to diagnose them or give them advice on what to do, because you aren't a medical professional. You don't know what they're going through. You don't know how to help them. So just be a good friend who can listen to them and help them get their feelings out on the table. It might be necessary for you to recommend for them to go to therapy or something like that if they mention having suicidal thoughts or self-harmful thoughts. If they do mention that, then that's the one time you can give them advice and you should be like, I think you need to go to therapy. Overall though, the best thing you can do is be a listening ear and be a good friend to them. In conclusion, dissociative identity disorder is a serious disorder that can lead to serious consequences if left untreated. It is developed because of trauma, it affects your sense of identity, and it can lead to serious and dangerous psychological effects. If someone comes to you with DID, the best thing you can do is be a good listener. If you have DID, the best thing you can do is talk to a professional. Thank you for listening.